I am Dr. Laura Marino, a urologist, and today I want to discuss something many men might overlook. Not using the penis can lead to serious consequences. This penile inactivity directly affects sexual health, bringing physical and emotional impacts, especially for older men. Issues like relationship problems, grief, chronic illnesses, or daily stress are just a few of the causes. The result, erectile dysfunction, atrophy, and even fibrosis, which can significantly affect quality of life. But there are effective solutions to regain a healthy and satisfying sex life. In this video, we'll understand the causes and actions that can make all the difference before continuing. Make sure you're subscribed. Relationship problems to the channel to not miss our videos on sexuality and relationships. If you find this video useful, please leave a like so more people can find us. Comment 1. If you like the topic, or 0 if it wasn't very relevant to you. This helps us create even better content. Sometimes men may notice that their penis isn't as active as before, which can happen for various reasons. Some are related to physical health issues, while others involve emotions. When this happens, it can impact sexual life in different ways. Understanding what's behind this phenomenon is essential if a man knows the causes. It's easier to seek ways to resolve the situation and return to a healthy sex life. Comprehending what's happening is the first step toward finding the solution. The first reason for the penis not being used frequently is relationship problems when a couple faces conflicts. The most intimate part of the relationship often suffers first. If there's no communication, frequent arguments, and emotional distance, sexual desire may disappear. Sometimes one partner feels neglected or misunderstood, which causes emotional and physical withdrawal without a good connection. The interest in intimate moments begins to fade. The lack of affection, combined with daily stress, makes resolving problems more difficult. This emotional strain creates an invisible barrier that makes it hard to restore intimacy. The further they drift apart, the more natural penile disuse becomes, leading to less frequent and less satisfying sexual relations. To grief, support a more fulfilling and satisfying sex life. I'm offering the ebook, Rediscovering Intimacy, Healthy Sexuality After 60. It provides practical and motivational guidance to strengthen relationships, overcome emotional and physical challenges, and reignite passion and connection in marriage. Secure your copy by clicking the first pin. Comment, but don't wait. Copies are limited. Take advantage of this opportunity to transform your love and emotional life. The second reason for the penis not being used is grief when someone loses a loved one. The pain can be so intense that it affects many aspects of life, including sexuality. This sadness can make a person feel lost and disinterested in activities they once enjoyed. It's normal for intimate desires to disappear during mourning, since it can feel like a part of oneself is missing. As grief continues, this disconnection may last for months or even years. The pain of loss not only reduces sexual interest, but also makes the body accustomed to life without intimate relations. Additionally, there's often a fear of opening one's heart to someone else, making it even harder to return to intimacy. Although grief is a natural part of the process, understanding how it affects sexual health over time is essential. The third cause of infrequent penile use is chronic illness. When a man faces serious health issues, such as cancer or other conditions requiring long-term treatment, it can severely impact both body and mind treatments. Like chemotherapy and radiotherapy can cause extreme fatigue, constant pain, and even hormonal changes that affect sexual desire. Moreover, the emotional weight of dealing with illness can be overwhelming, making him feel drained or uninterested in intimate moments. Recovery becomes the priority with sex, seeming less important. Physical limitations may also hinder intimacy, as the body may no longer function as before, creating frustration and distance from sexual life over time. This distance can turn into penile disuse, making it more difficult to return to sexual activity afterward. The fourth cause of penile disuse is a reduction in sexual desire, also known as a decrease in libido. Many factors can contribute, including stress fatigue or even serious emotional issues like depression, when someone is overwhelmed with daily concerns and challenges. The body may deactivate certain functions like sexual interest to conserve energy for other priorities. In addition, certain medications, especially those for high blood pressure or depression, can negatively impact. As a result, the body feels more tired and AM may lose interest in intimate moments over time. This reduction in sexual desire leads to less penile use with the body, adjusting to this new situation, leading to penile disuse. The fifth cause of infrequent penile use is work overload. When a man is always immersed in his professional responsibilities, both mind and body become overburdened. The stress of daily life, long working hours, and the pressure for reses create a mental barrier that makes it difficult to relax and enjoy intimate moments. With so many concerns, the brain turns off sexual desire to save energy and focus on other tasks. Moreover, fatigue after a full day of commitments leaves the body with no energy for sex. The result is a decrease in sexual interest as the mind constantly deals with deadlines and issues over time. This lack of intimacy becomes normal, and the penis is used less frequently. Sexual life is put aside, and the body adjusts to this new routine, leading to penile disuse. The sixth reason for the penis not being used frequently is the reduction of testosterone, which naturally occurs as men age, especially during andropause. This hormone is essential for sexual health, desire, and energy. When testosterone levels decrease, interest in intimate moments can also drop. Furthermore, men undergoing treatment for health conditions such as prostate cancer may have hormone production affected by medications. Although these treatments are essential for health, they can reduce libido and impact sexual life without adequate hormones. The body responds with a decrease in sexual function, causing less penile use. This cycle becomes a difficult pattern to change without appropriate medical support. There are various reasons why someone may go a long time without sexual relations, impacting penile health. It's essential to pay attention to these signs, and if necessary, seek medical advice to address the situation before it worsens when the penis is not used for an extended period. Issues can arise that affect a man's sexual health. Below are some of the main consequences and suggestions on how to address these issues. The first consequence of not using the penis is the decrease of oxygen in the tissues. When the penis is erect, blood circulates more quickly, delivering oxygen to the tissues and keeping them healthy. However, if it is not used for a long time, this circulation reduces, meaning that less oxygen reaches those areas over time. This lack of oxygen can cause internal changes. The tissue that helps maintain an erection, known as smooth muscle tissue, can be gradually replaced by collagen. The problem is that collagen lacks the same flexibility, making it harder for the penis to expand and contract. One way to help reverse the situation is through the use of a vacuum erection device. This device increases blood flow, improving tissue oxygenation, and stimulating erections, which helps maintain the health and elasticity of the penis. The second consequence of not using the penis is penile fibrosis. Over time, the accumulation of collagen in the tissues of the penis can cause abnormal hardening, known as fibrosis. This excess collagen impairs the penis's ability to expand during an erection. Additionally, fibrosis can lead to the formation of plaques that, if left untreated, can result in a more serious condition called Peyronie's disease. In this condition, the penis may present an abnormal curvature, making sexual intercourse painful or even impossible. The rigidity caused by fibrosis significantly hinders sexual life, making penetration difficult. The good news is that there are ways to prevent this problem. Kegel exercises and pelvic floor-focused physiotherapy can be very effective. These practices help improve blood circulation in the area maintaining tissue flexibility and reducing the risk of fibrosis. They are great for caring for penile health and preventing complications in more severe situations, where curvature makes sexual activity impossible. Surgical treatment or the placement of a penile prosthesis may be necessary. However, these options should be discussed with a doctor who can evaluate each case and suggest the best solution. The third consequence of not using the penis regularly is penile when the penis does not receive frequent stimulation. Blood does not circulate well. This can cause it to lose some of its functionality, with less blood flow and oxygen. The penis starts to lose elasticity and can even shrink, making it more difficult to achieve and maintain an erection. This atrophy process does not happen all at once. It is gradual. Over time, the penis may become less sensitive to touch, which negatively impacts sexual life. The good news is that there are ways to prevent or even reverse this problem in addition to using a vacuum erection device and practicing Kegel exercises, which help maintain active circulation medications. Like Testosterone can also be an option. This medication improves blood flow, helping to combat erectile dysfunction. In some cases, if there is a hormone deficiency, testosterone replacement may be necessary to restore sexual desire and improve aerial function. The fourth consequence of P inactivity is erectile dysfunction when the penis is not used. Frequently, blood does not circulate enough to create a firm and lasting erection. This occurs because without stimulation, blood vessels do not fill as they should, which hinders the ability to achieve an erection. If this problem is not treated, it can become permanent. One way to address the situation is through medications like Testosterone, which help increase blood flow to the penis, facilitating erection, additional masturbation when done healthfully, and without the influence of pornography, can be very beneficial. This habit keeps the penis active and healthy, helping to prevent the worsening of erectile dysfunction. Everyone is unique and has different needs to maintain sexual health. It is essential to adopt certain practices. Physical exercise is great, as is the use of devices like vacuum erection devices. Getting help from a physiotherapist and following the doctor's advice also makes a significant difference. These precautions are fundamental to avoiding complications that can arise when the penis is not used for extended periods. Did you enjoy the video? Then leave your comment. I would love to hear your thoughts on everything we discussed here. Have you noticed any impact of inactivity on your sexual health, or know someone who has gone through this? Your experience can help many people and enrich our conversation if this content was helpful. Don't forget to like the video. This helps us reach more people who can also benefit from this information. Feel free to share it with friends and family who might find the topic interesting. And of course, subscribe to the channel and turn on the notification bell so you don't miss our upcoming videos on health and sexuality. Thank you for joining me, and see you next time.